Long-term sequelae are reported in a large majority of patient survivors from Stevens-Johnson-Lyell syndrome, also named epidermal necrolysis. However, few studies investigated the global burden of the sequelae and the health-related quality of life in these patients. The objectives of our studies were to investigate the long-term quality of life in EN survivors and to compare the quality of life between patients admitted or not in intensive care unit, ICU, during the acute phase, and to assess the burden of sequelae and to compare the patients admitted in ICU and those survivors from septic shock. This monocenter study enrolled patients admitted for EN between 2010 and 2017 and used phone interviews conducted by dedicated nurses. Quality of life was assessed by using the SF-36 questionnaire and several other quality of life scales. We also performed a questionnaire about specific sequelae. The primary outcome measure was the physical component summary score of the SF-36. ICU patients were subsequently matched to a cohort of septic shock survivors from other causes. We included 57 patients, mean age 48 years old, 38 female, interviewed 3.5 years after the acute phase. 1/3 of these patients had been admitted in ICU. The median physical component summary score was 0.44 standard deviations below the matched population reference population, and was significantly lower in patients admitted in ICU versus patients not admitted in ICU. We also found that the impairment of quality of life in patients admitted in ICU was similar to those of survivors from septic shock from other causes. Scores of anxiety and depressions were impaired in respectively 54% and 21% of patients. Reported sequelae were cutaneous in 77% of cases, ocular in 70% of cases, psychological in 60% of cases. And the mean intensity scale was between 5 and 6 out of 10. To conclude, we found the physical component of quality of life impaired in epidermal necrolysis survivors much more than in the French reference population, and a poorer physical quality of life in patients who had been admitted in ICU. A high proportion of patients exhibited symptoms of anxiety and depression and post-traumatic disorder. Most patients declared having disabling specific sequelae, especially ocular and psychologic, which confirms the morbidity of the disease in the long-term chronic phase. This study confirms the need for a prolonged multidisciplinary approach for the follow-up of these patients.